Survivors continue to encounter multiple barriers which are limited access to integrated services such as shelter, psychological support, legal aid, and medical care. We have an even distribution of GBV protection centers across our counties, weak coordination and referral pathways, ongoing stigma, harmful social norms, and widespread under-reporting. Of course, in the afternoon sessions, we also broke into the breakout sessions, which were also again split into 3 groups. I believe we'll have the same today, depending on the program. We keep on shifting and alternating the program as we assess the proceedings of the day, but I believe those breakout sessions were very important, and from the word that I got, they were also very engaging. In conclusion, while progress was acknowledged, participants were clear that it is no longer sufficient to focus on incremental improvements. There was a collective call for coordinated, well-resourced, and fully implemented systems that guarantee every survivor's access to safety, justice, and recovery services. The current priority is to translate these commitments into action through legal strengthening, sustainable financing, and coordinated implementation to ensure that every GBV survivor has access to timely, quality, and survivor-centered protection services regardless of their location. That was the recap of yesterday's proceedings. And with that said, we now want to get to today's presentations. And first in line, I'd love to welcome a lady by the name Geraldine Omukaga. She serves as the Senior Gender Officer at the State Department Office. She'll be doing a presentation on promising models operating in Kenya, tying it with issues pertaining to the technical manual on safe houses. Geraldine?
Yeah, good morning. Yeah, I'm so glad that we all managed to come here despite the challenges. My name is Geraldine Omukaga from the State Department for Gender. And I'll be taking you through the models for establishment safe and protective centers in Kenya. And, okay, there it is. Kindly just project. So in the model that we have, these are the outlines of what is stated in that model. We have an introduction. We have definitions of safe and protective centers and the models for coming up with safe and protective centers. We also have the legal and policy frameworks that supports the establishment of the safe and protective centers, the guiding principles and the standard procedures for operating the GBV protection centers and the safe spaces. And I will first start by giving an introduction of the Executive Order number 1 of 2025 that mandates the State Department of Gender with some of the responsibilities that we are to implement here. Down is on policy and programs on prevention of and response to GBV. We also mandated to support with gender violence protection centers, the safe houses and shelters for victims and survivors of GBV and femicide. Another responsibilities on tracking, monitoring, and reporting of all incidences of sexual and gender-based violence and femicide. There's also a responsibility of coordinating all stakeholders and in the implementation of the efforts towards elimination of all forms of sexual and gender-based violence. So those are some of the responsibilities that the State Department for Gender was given the mandate through the Executive Order number 1 of 2025. I'll just briefly be able to define what a safe and protective space is defined in the manual, and it is defined as a physical or non-physical, formal or informal, public or private, non-stigmatizing and culturally appropriate place where women, girls, and children can go to at any time to feel safe physically and emotionally, to feel empowered, and to have access to information, education, and recreational facilities and other support services. Some of the models for establishment of safe and protective spaces. We have a number of them and we have various models. The first model is on safe and protective spaces within the service delivery points. These are models that can be informal or formal. They could be in public or private, with facilities providing different services, and the services could be on sexual reproductive health and HIV services, life skills, counseling, and child protection. And it utilizes the existing facilities and structures, including the staffing. The second model is on community-based, which is community-based model. This one provides families, and they are run by trusted community resource persons like the women groups, youth groups, community health volunteers, paralegals, human rights defenders, faith-based organizations, and these ones are cost-effective since they utilize their activities. The third model that of the safe and protective spaces is the emergency response spaces. These are temporary physical spaces which are set up to meet immediate and short-term needs of the beneficiaries, either during emergencies or humanitarian situations. And emergency preparedness and response plans should include GBV, sexual reproductive health, and HIV prevention and care services. There's the one-stop center. These are spaces that provide comprehensive services under one roof, and they're effectively linked to different sectoral responses to provide a full array of services like health, psychosocial, safety, and security, legal and justice services, and livelihoods. They can also be located in health facilities like the GBV assists in hospitals, police stations like the polycare centers, or faith-based organizations. The other one is on the safe shelters. This is also a model for safe and protective spaces. These ones are permanent structures that offer immediate protection, safety, psychosocial support, and other services to GBV survivors and their families. They are professionally run following a stipulated SOP, and they provide or facilitate access to comprehensive services for a holistic recovery. It also provides reintegration and aftercare services. The sixth model is on high security spaces for protection. These are safe spaces for survivors of GBV, their families, and witnesses facing threats and are at high risk of harm. The beneficiaries are usually provided with asylum and access to justice, emergency shelter and security, the economic empowerment and integration services, and community support groups that makes the reintegration of the survivors back to the community smoothly. Allow me now to take you through the legal and policy framework, since this was done comprehensively yesterday by my director, Mr. Kariuki. So I think this was done comprehensively yesterday, so I'll go straight to some of the guiding principles for establishing GBV and protection centers and safe spaces. And these principles seeks to promote, protect, and uphold the human rights of the survivors. So number one guiding principle is on safety. This prioritizes the physical and psychological safety of the victims, staff, and all the persons operating in the facilities. Another guiding principle is on the best interest of the survivor, and this one guides on the actions concerning victims, that is either the children or vulnerable persons, shall be given primary consideration to their best interest. There's confidentiality. I think we are all privy to that on matters of confidentiality when it comes to running a GBV or protection or safe spaces, non-discrimination and cultural sensitivity. These services must be provided without discrimination based on gender, disability, race, religion, nationality, or social status. Another one is on accessibility. The services and facilities in the protection centers must be accessible to all persons, including persons with disabilities, older persons, and other vulnerable groups. And something else that was raised yesterday, it should be accessible to the creating accessibility to each and every person. There's coordination and collaboration among relevant stakeholders, which includes health and social services, law enforcement, and legal aid provision. There's a trauma-informed care. Service providers must be trained on trauma-responsive approaches in supporting and handling the survivors of GBV. Compliance with the national standards, laws, and policy governing financial management, record management, and service delivery. So some of the minimum standard procedures for operating at GBV centers. We have the registration of GBV protection centers. In the manual, it brings out a clear guideline on the registration process of protection centers and safe spaces. I think allow me will be able to get this and be able to read further on what's expected in registration of some of these protection centers and safe spaces. There's a governance structure that gives a framework for accountability, transparency, and effective service delivery. That one too is in the manual. Kindly allow me now to take you through the governance structure because it's clearly been stipulated in the manual. Another one is just on compliance with the relevant legal structures and frameworks that have been set in place. Financial management too, it's so clear there on some of the way that finances should be managed in the protection centers. That is conducting annual financial audits by certified auditors, should provide audited financial reports to the relevant government agency, and the first one is so obvious. Some of the staff requirements there have been clearly stated there on protection centers shall employ qualified personnel, and the definition of the qualified personnel is listed there. So in the manual you'll be able to get some of the qualifications of the staffing in the protection and safe spaces. The infrastructural requirements have also been clearly stated in the manual that we are all be able to access through the link that was shared to all the participants who are coming to this meeting. But allow me just to briefly take you through some of the infrastructural requirements. You must designate separate and secure residential areas for different categories of victims. That is for the men, for the women, the children, the persons with disabilities, and the older persons. There must be adequate space for administrative and integrated victim-centered services. It must also be child-friendly and disability-inclusive. That have amenities that will take care of the children and those with the disabilities. It must also have adequate security infrastructure, which includes perimeter fencing, controlled access, and emergency response systems. And protection centers may also include the following essential components, which is a reception and having a reception and an intake area, safe housing and accommodation, medical and psychosocial support area, security and safety. Where protection center may outsource or partner with relevant stakeholders in provision of some of these infrastructural requirements that have been stated up there. Operations of a protection center, they must have a data management system that informs the programming and case management of the victims, and admission to the protection centers must be available 24/7, and the protection center shall also provide access to sufficient food, water, clothing, bedding, personal hygiene items to the victims and the survivors to ensure that their health, dignity, safety, and well-being is taken care of. A protection center shall also have a case management plan for each survivor, outlining the support services and the interventions that are available. On admission and intake process, A victim may be admitted to a protection center through either self-referral. It can also be referral by law enforcement agencies. It can also be from the health and the educational facilities, by social services, which includes social welfare officers or gender officers, and by referral by civil society organizations, which may include faith-based organizations, helplines, and media, or any other interested persons. And the documents required for identification to be able to assist in the referral pathway, they are listed. Kindly allow me now to go through the requirements. You'll be able to read them through in the manual. On reintegration and aftercare support, that is the exit strategy. On discharge and reintegration, a survivor shall be discharged upon completion of a medical and psychosocial recovery plan, a safety assessment confirming a secure living arrangement, and provision of legal support if the case is ongoing. The Protection Center may also facilitate reintegration through linkages to economic empowerment programs, family reunification where appropriate, continued psychosocial support and follow-up services for at least 3 months after post-discharge of the survivor. It may also offer integration services, which includes implementing a plan for integrating survivors or clients back to their family and community, give an assessment of the safety and security of the client, whether in her initial residence or the new allocation, depending with the situation, and making follow-up support for a minimum of 3 months post-discharge. Some of these linkages to long-term social protection programs can also be given, and continued access and counseling and empowerment initiatives to survivors who are being reintegrated back either to their homes or to this permanent other safe spaces. Thank you for that. Thank you.
Thank you so much, Geraldine, for that presentation. Thank you. Please let's appreciate Geraldine for that presentation. That very well articulated the aspect that will be setting the foundation for today's panel discussion as well. At this moment, allow me to invite Ms. Margaret Chepchumba. Let me invite the Executive Director from GVRC, Ms. Alberta. Karibu sana.
Just tell Margaret to go to the reception. Margaret will come by in the meantime.
Thank you. Ms. Margaret Chepchumba, please let's meet at the reception area as we prepare for your presentation. In the meantime, let me please invite the Executive Director of GVRC, Ms. Alberta. Please appreciate her as she's coming.
Asante sana. Good morning, everyone. Good morning. Ningekuwa hapa mkidance. Ningewashinda. So as you heard, my name is Alberta Wambua. I work at the Gender Violence Recovery Center. As requested by Dr. Obonyo, do I need to? Okay. So I'll just go straight away to GVRC, popularly known as the Gender Violence Recovery Center. It's an arm of the Nairobi Women's Hospital Group. We are 25 years old and mostly known for response of gender-based violence. So response to gender-based violence, all forms of gender-based violence. I'm seeing a former colleague. So yes, and that includes medical treatment and psychosocial support. It's in 5 counties. We have 8 centers, so 8 GVRCs. I'm here to speak about GBVRC, so I'll talk about it shortly. So GVRC, from its learnings in terms of response, after about 3 or 4 years since inception, we got into the space of, can we then prevent gender-based violence as opposed to just waiting for survivors of GVRC? And these are survivors from both genders, all ages. The youngest sexual violence case has been a 3-year-old baby, and the oldest 105-year-old. We've supported about over 65,000 survivors of gender-based violence. And then again, there's also the emergency response program. So for example, around the electoral violence, around the COVID-19, around the Mount Elgon crisis, the Tana Delta crisis, we have supported over 180,000 survivors of gender-based violence. At no cost to the survivors, but at a cost to GVRC. Then there's a prevention program. So we go and say, so how do we prevent gender-based violence from happening? And there's also an advocacy program. Now, with all these learnings meaning there were mistakes, there were achievements, GVRC said, why don't we replicate this model into county government hospitals? And that's how we have now the GBVRCs, which I'm here to speak about. So the GBVRCs in full is the Gender-Based Violence Recovery Centers. So there's a national GBVRC model paper that was together with the State Department, headed by the State Department of Gender and Affirmative Action and different partners. There's a model paper then now that's being used to replicate this model. It's an integrated model. So GVRC, you'll never come and find a GBV center by itself. It's an integrated model within the Nairobi Women's Hospital. So that has helped survivors to be able to come and get treatment without discrimination, without stigma. It has also helped us in terms of capital investment. Capital means we don't have to look for doctors, we don't have to look for clinicians. 1 year. But what comes heavily that we have to do is to continuously enhance the capacities of the clinicians, of the doctors, of the psychologists, the social workers, to be able to manage the survivors of gender-based violence. So this is what then we replicated in so far 16. So now we have, as GVRC, we've been able to set up 16 gender-based violence recovery centers. And the idea is to enhance access to services for survivors of gender-based violence, as you just heard. And the services offered there, as you just heard also, is the medical treatment, psychosocial support, including that psychological and the social follow-up, the social assessments and the follow-up, and also the legal representation of the same. And of course, then enhancing the functional referral pathway. So as you talk about gender protection, gender-based violence protection centers, you have the GBVRCs, you have the shelters also within that component. Now, GVRC with the 16 that we've been able to set up, last year being, our year runs from April to March 2020, April to March of the following year. So from 2025 to 2026, at the GBVRCs, they were able to support 1,316 survivors of gender-based violence. And a big percentage of this, which is 83%, was sexual violence cases. Now, this mirrors with the national statistics, but also with the statistics that we have at GVRC in terms of the percentage of sexual violence cases. The only challenge has been, and I'm off to the challenges a bit as I go to the achievements also, is that a lot of the survivors at the gender-based violence recovery centers would come for treatment after 72 hours. We know it's important to come within 72 hours to be able to get the prophylactic treatment or to be able to get treatment that will prevent you from getting HIV, from getting pregnant, from getting sexually transmitted infections, from getting hepatitis B, and to also get the treatment. So that is what has been the challenge in these centers. Again, 17% of the survivors who came to these centers were with disabilities. And of all the 16 that we set up, Makueni was the one that received the highest the highest number of survivors. Now, the counties that we've gone to, or rather the counties that have had GBVRCs, I'd like to mention that it's not just going and setting up a center. You have to have the whole ecosystem in play. So some of the counties like Homa Bay County, for example, we've had to work with in all of them, we work with the county government, but there are those ones where you'd go and find, like, the policies are not in place, or the policies need some enhancing. So that has happened in a couple of the counties. In some of the counties, like I would give an example of Makueni and Kilifi, as you open the gender-based violence recovery centers, then they realize that we also need a place to take the survivors for shelter, because it's a whole ecosystem. So then they've set up shelters also in those counties. I'll go to the challenges of GBVRCs. So one has been inadequate funding. It's been a struggle within the counties to get resources, let me call them that, for the treatment of these survivors. In most of the GBVRCs, we've had to print, for example, the post-rep care form and sharing that with them. So that has also been a challenge. The referral pathways, where do you link the survivors to? Because then a lot of the shelters, for example, are not within those communities. Or specialized care. Specialized care, when you, for example, need a child who needs a pediatric surgeon, it's very hard to get them within the facilities. So they would have to be referred to GVRC. We've also had shortage of trained personnel. There's a very not adequate pre-service training for clinicians and also all the other duty bearers in that space. So then that has also been one of the challenges that we continue to address within the GBVRCs. Again, as I speak to the trained personnel, let me talk about the technical assistance that's also provided. So it's not just setting up and leaving. The lessons that we've also learned, seems obvious, but we've learned them, is that each county and each level of care is at different level in each of these counties. So in some of those counties, for example, you'd go back and they'll tell you, we are struggling with data management. Or you'll go back and they'll tell you, we are struggling with secondary trauma. Or we are struggling with burnouts. So how do you deal with this? And how do we have provision for that? And can you continuously provide that support? So that has also been one of the challenges. In terms of infrastructure, that has also been a challenge. So you'd go to the hospitals, or as mentioned earlier, some of them are within the hospitals, most of them are. So you go to the hospitals and they are either structural or physical, barriers. So for example, how do you incorporate ramps, and disabilities? How do you incorporate sign language? There are survivors, for example, who will not be able to communicate. How do you, some of them have survivors like in West Pokot, survivors that would come from across the country, out of child marriages. So how in terms of language barriers and things like that. So those are some of the barriers that have been there. Stigma and underreporting, remember the survivors are coming from the same community. In one shelter that I went to, I met young girls, they were told about 10 of them can come and share their experiences. There were about 100, they all wanted to share. And they were small girls, about 15, 14. They're talking about how they escaped from their marriages. It was so sad. And some of them were talking about how there was, lack of a better word, sold by their siblings and their fathers. And when they were running away from their homes and they managed to escape and go to the chief beats them and takes them back. So what's there, then that also ties up with the cultural and social barriers, is that they're within the same community. We've gone to, I won't say which one, but some of the GBVRCs where you're having female genital mutilation survivors. But when they report to the center, it's reported as excessive bleeding. They don't outrightly say that it's female genital mutilation. So those are some of the challenges that we faced, including the weak legal process. A lot of clinicians would come and say, we are not comfortable, we are not confident to go to court and provide medical expertise in court. At GVRC, I'll say that's also a challenge. Also from the survivor's point of view, very few want to follow up with the legal process. In a year where we supported about, last year actually, 3,281, we only had about 600 court representation in courts. So that shows you the link between one service point and then next. And that is also worse in the communities that we support. So I think that's all for the GBVRCs. I'll also add that there are also emerging trends. It's also been a challenge. So how do we quickly adapt and respond to the emerging trends, including technological facilitated gender-based violence and also the femicide cases? And how then do we also have some of the other challenges, as always been saying, is how then do you consolidate this data so that then you have a central depository and don't have a duplication in terms of counting of the same. I don't know, Mr. Bonyo, should I, Dr. Bonyo, there's someone else for Polycare? So thank you.
Someone who's come to, I'll just mention her name, but you can do the or I do for So, just have, I'll use this one so that you can be able to.
Okay. Yeah.
Okay. As we understand today, the situation the way it is, NPS representative is not able to be here with us because they've been called on duty, but they've worked very closely with the State Department and also the GBVRC with regards to Polycare. And therefore, we're going to allow Ms. Alberta to just give us a snapshot about what Polycare does. And that's actually a one-stop model that we should all emulate. So, Karibu Alberta, and thank you for that.
Okay, thank you. Okay, so now I'll switch to Polycare. They do it so passionately. I might not reach their level, but I'll try. So Polycare means the police cares. It's a brainchild of a beautiful lady called Zipporah. And it started some couple of years back. And the idea was, how then do you have one-stop shop? And I remember very well, it was also learnings from Isange. Isange is a police hospital in Rwanda, where then they would have all these services that Geraldine spoke about earlier under one roof. So currently we have 2 Polycare centers. We have one in Laikipia and we have one at the traffic police. So the one in Laikipia, so I'll speak from someone who visited and spent some time there. So they have a clinician. So they have, of course, the receptionist, who's a sociologist. They are cops, but they are trained in their specialty. And you'd go in, so that's the client flow. If they didn't rescue you, and it's important to mention that even at GVRC, 2/3 of the referrals to GVRC now are from the police. So the survivors would come, they would get assessed. There's a forensic room, they would get assessed, they'd get history taken, they'd get assessed physically. They have a doctor from the hospital who is stationed there and is able to provide that treatment. And they're treated. So they don't have the legal part yet, but they have legal in terms of the magistrate sitting there, but they are working on it. And that's when they'll also pick in the post-rep care form. If it's a rep case, they'll also fill the P3 form and then have the client referred if then they need a shelter. They get a lot of support from the OCPD who's stationed there in terms of resources and things like that and support. Now, with Polycare, for me, then it works so well because, for example, when we use all these others, when we have the hospitals and we have the police, once you treat the survivor, for example, at GVRC, we are able to fill the P3 form. But if you go to another hospital, you're not able to fill the P3 form unless you're a government doctor. So then you'll have to go to the police to get your P3 form filled. It's a long line. The very few police doctors were able to do that. Sometimes it costs you, and those are some of the challenges that Polycare has come to address. Allow me, Dr. Obonyo, to also mention, apart from the Polycare, the police also have gender desks. So the police have gender desks spread out in different police stations where you're able to go and report safely, because a lot of times you don't want to go and report somewhere where you're being judged, and we all know there's a lot of stigma around it. So what were you wearing? Why are you out at this time? So it gives you it gives you confidentiality and a safe space and people who are understanding for you to report. So they also have gender desks. Police also have a child protection unit. Some of the police stations, and I think, Honorable Passaris, there's one that you also supported in Nairobi. Some of the police stations have child protection units. One that I know of is Kilimani Police Station. So they have a child protection unit where children are able to come in, they're able to report, they're able to get the support. The police are able to take them to the nearest health facility and they get treatment, and they also have short-term shelter, meaning that the children are able to stay safely for a day or two, because for children, most of the perpetrators are actually people close to them or to family. Homa Bay also has a child protection unit. I know there's one in Ukunda. I'm not sure it's now operational, but there's a really nice one built there that needs to be operational. So those are some of the child protection, centers that the police have. Let me call them child protection centers. So that's the polycare, we have the gender desks, and we also have the child protection units. The police have also been able to recently finish on their standard operating procedures on GBV management. We know very well that's one of the first responders, but it's also very key in terms of forensic management for them. So they're also, I think, finished on working on their manual around forensic management. They've also finished working on their manual around technology facilitated gender-based violence. And there's also components of training that they have before service for the same. One of the things then that we all push for is to have a unit that responds to gender-based violence under the National Police Service. Asanteni.
Thank you for that presentation, Alberta, giving us insights on the model for polycare centers. Of course, as we are very much well aware, the NPS is engaged today. So let's move on to our panel discussion for this day. Our first panel discussion, which focuses on experience sharing from the GBV shelters. What works? What breaks down? We're looking at those safe house operators and that conclusive discussion that we are just about to have. So I'll invite my panelists to the stage with me here, and maybe if I could get some assistance moving this podium just somewhere onto this other side. Okay, so our first panelist is Georgina Dulu. She's a gender director from the State Department office in Kilifi County. Is Georgina around? Georgina? All right. Georgina, you'll take your seat here. So as I call out the names, you'll just continue seated as the arrangement has been made. Next, we have Ann Barasa, who's a gender director as well, serving at the State Department office in Bungoma County. Is she in? All right, she's here with us as well. We have Doris. I wasn't able to get the second name. Apologies for that, Doris. Doris is from Maisha Trust. Is Doris in? All right, very well. Here, let's begin as we. Then we'll have Caroline Sakwa from SHOFCO. Is Caroline around? Okay, then finally, I'm being told we have other participants who will be joining us virtually. Well, we'll try and see how that works and proceed with it as we proceed. The next seat there, Carl. And I'm being informed we have Henry, Homa Bay Shelter. Henry? Is Henry in? All right. Take the final seat. We'll try and accommodate as many of you as possible. So just walk with me. I believe we don't have too many mics, but we'll get to share the ones that we are having with us right here. So yes, this is our panelists. Again, thank you for joining us and just basically spending time to discuss what we're just about to discuss. And I'd love to maybe begin with Caroline, since you're getting this first-time access with these survivors. Before we get to the other technicalities of the whole ecosystem, we're looking at the first 72 hours of these cases being reported. So what would you say, since you've had, I believe you've had the first-hand contact with these survivors, would you say are the most critical things to be looked at within those first 72 hours of these cases?
Okay, within the first 72 hours, at the point of referral, when a survivor is referred to a safe house, like for example, SHOFCO has been running safe houses for the last 10 years. We have 2 safe houses in Nairobi, and we are supporting the county ones. Within the 72 hours when our client is referred, the first aspect of support is, first of all, we try to understand, is this survivor supposed to be rescued from a particular location? If the survivor is supposed to be rescued, so our case management rescue team are basically informed about the rescue process. They engage into the rescue process. The first item to be done is the assessment of the case. It's just a GBV case. From the assessment process, the case management team that works with the regional leads are able to analyze the case deeply, and they're able to identify the intervention that needs to be done within 72 hours. So within 72 hours, if it's a sexual gender-based violence case, the first instance is to take the client to a medical center, that is a gender recovery center, for them to receive medical care. After that, the client is also given a time to understand what has happened to them, and they've received medical care, they've received counseling. Coordinate for the client to be taken directly to whichever police station within the jurisdiction of the incident. They report the case, and now we start following up with the police, and eventually the client is admitted into the safe house. That is if it's an SGBV case. If it's a domestic violence case or any other physical assault case, the case is also assessed. The process, they are also admitted, giving the psychosocial support and the full support within a home where people receive basic needs, proper food and nutrition and all that.
Okay.
Thank you.
It's a good thing we have Henry from Homa Bay County, and Homa Bay County is one of those counties with the success stories of these shelters and spaces. Henry, in terms of recommendations and looking at the emergency responsive systems, what would you recommend that is needed to strengthen this, to make it better?
Okay, thank you very much. I'm Henry Agunga, Agenda Officer working with the County Government of Homa Bay in the Department of Gender Equality and Inclusivity, and serving also as the shelter manager and Bewa safe space. Amongst recommendation is one, what we talked about yesterday, that is domestication and having a national integrated framework, legal framework, that will help in this, because of all those things that Akaro has mentioned. You'll find that there are gaps, especially when survivors are found. GBV, SGBV, and then the onboarding process until they are exited from these. Lack of structured frameworks that can help implement the survivor-centered approach that we can only offer at the safe space. We need to go beyond this, and looking at the gaps that we had yesterday, if we have this framework, then it will be a plus to the survivors that we receive from the safe working out. One is yes, I've mentioned about the survivors-centered approach. And then I will also say safe spaces need to be within our operation. There's about 40 wards and 11 sub-counties. We only have one safe space. And look at the data, whatever is being shared that is informing our intervention. We have many survivors, but where do we take them? So if that can be put into consideration, that the construction of more safe spaces, that can be good. Another thing that we can put into consideration is, yes, we have a working county gender sector working group at the county level, but there are gaps within the sub-counties. They used to be, but right now, because of 1-2 reasons, they are not functional. So you find that cases within the sub-counties and ward levels, it takes the intervention of the county sector working group to come in. But if this can be devolved downward, then it will be a plus to that cause.
Okay. Let's talk about the financing bit. We've acknowledged that the biggest underlying factor when it comes to these operations is the minimal funding, for lack of a better word. And I want to come to Anne and Georgina. Let me begin with you. When you're looking at this funding, there's the aspect of people not necessarily understanding the financing model. Yes, there's the push to set up a dedicated fund to be dealing with GBV, but in a layman's language, how would you explain it to somebody in Kilifi and tell them this is how this whole process is funded?
When we talk about the financing model bit of it, and in a very layman's language, in every institution, in every setup, we must have some resources to make sure that the day is running, and that includes food, it includes utility, it includes human resource, because there has to be security officers, there has to be a manager, there has to be a counselor, there has to be a social worker. So there's a lot that comes with a shelter. And when you talk about resources, there are so many ways of resource mobilization. For the government, for the county governments, for example, for Kilifi, this financial year, at least there has been an allocation into this year, this coming year's financial year in terms of running the newly established Kimbilio Rescue Center. From the national government, funds cascading to the State Department, they're still minimal, but at least to some extent they are able to support the coordination in terms of the county gender sector working group, considering it pulls a lot of stakeholders that have interest and passion and commitment into giving the best services to the survivors. Additionally, we have a pool of partners that we have that we continue to seek the support and their collaboration, and such organizations include now SHOFCO, and for Kilifi County, specifically Kimbilio Center, they have been able to support us in constructing a kitchen, a dining hall, and also an empowerment hall within Kimbilio shelter. And there is also the process of equipping the Kimbilio shelter, because it's very new, and we are still grasping and seeing how best we are going to make it fully operational. So there's a lot that comes, when it comes to mind about funding, there's a lot that comes with it.
Okay.
Yeah.
Let me come to you, Anne. She's mentioned in Kilifi, at least the coming financial year, there's been an allocation for this. Back in Bungoma County, not too sure, maybe I can be corrected, in one of the breakout sessions I had, is it Nyeri County, one of the counties that has a specific law for the same? I'm not too sure in terms of policy. So I'm really trying to understand, when you're looking at how the policy is structured in Bungoma County, how hard of a task is it in terms of ensuring this funding comes through?
Okay, thank you so much. My name is Anne Baraza. I work for State Department in Bungoma. I want to say Bungoma is a very unique county because at the moment we have a lot of cases of GBV, especially SGBV, but still we do not have a functional shelter so far. But we have private shelters, and as far as I'm concerned, we don't have a fund, even with the county government. There is no fund so far that has been set apart, because even the policy on GBV policy has not yet been finalized. So without a policy, it's not possible to set apart any funds towards that. But we are working on how to operationalize the shelter that exists in Bungoma. So that is underway. But the challenges we have, we seriously need a fund. Where that fund would be hinged is, I think, is the policy that the national government, I think, should come out clear. Because I want to give an example. Like yesterday, there was a case that came up of a 3.5-year-old girl who was raped somewhere in Nalondo. Nalondo is somewhere in Bungoma Central, and she was raped by an uncle. And we have to swing in action to thank God for SHOFCO, because SHOFCO came in in helping to rescue that child, remove the child from of course the hostile environment, and even help in the reporting, going to the police, and this child has now been taken to the hospital. But you see, if we did not have SHOFCO on the ground, even the gender sector becomes almost incapacitated in terms of helping to rescue those cases. And the other challenge we have in Bungoma, especially like the region of Mount Elgon, we are at the border. Most of those cases happen, and the perpetrators, literally, they cross the border and they go to their relatives on the other side. You can't track them. Again, because of the aspect of kangaroo courts, when they realize you are using the Ministry of Interior, the police, to pursue even the survivors, because they have their own way of settling, they again cross the border. So without proper resourcing, it becomes a challenge, because even the police, sometimes they reach a point and they don't have the funds, they don't have the kind they don't have the resources to even enable them to track these places. You go to some parts of Bungoma, you find the only means of transport is a donkey, like in the mountain. So even how to bring that survivor from the deepest part of the interior to come to where they can be helped within 72 hours is a challenge. Okay. So those are we need that kit seriously, and I really would wish that the policy addresses even where that fund will be placed, or which institution will manage that fund. Okay. Yeah.
Maybe just before I quickly move away from you, Anne, I'm trying to marry the conversations we are having in the breakout sessions. There was a concern, I believe, again in Homa Bay County, in terms of the registration of these safe houses. There's a difficulty that when you're presenting this information to the government, then it comes a bit difficult to offer the help. Now you've mentioned you have private-run shelters. How does that work in terms of the security and reintegration of these people back into the community?
The truth of the matter is, those shelters, they are not registered as shelters. Okay. They are not registered even as rescue center. They are like, we have Kadui Children's Home. Most of them go as children's home, or it goes for a community, just an office for community-based organization that is providing providing rescue for the elderly, but we don't have them registered as rescue centers. Yeah.
Doris, let me come to you as Maisha Trust. We're existing in the wake of depleted donor funding. We're not seeing a lot of help or support coming from these other institutions. This means this work has to be done with us. In terms of improving coordination efforts between your partners, what has that been ever since we saw this sort of depleted support coming from partners?
It is Maisha Girls Safe House. I'm
Okay.
Doris Nasir from Maisha Girls Safe House. And now, in running a shelter, you realize that running a shelter is very expensive. And now we are looking at a donor funding that is really depleting. And in the work that we do, we've really we've come dependent on now the individual donors who are coming in to support these survivors, because they're seeing the work that we do and they're like, how can we support the shelter? How can we support you run the daily routines that you need to run within the shelter and support these girls? And now also, I can't really say that we can downplay the role of the government in supporting also the work that we do, because we've also gotten goodwill from the government, and that has allowed us the referral. Now that has supported our referral system. Now the government, with now them believing, some of the government stakeholders believe in the work that we do. So they really make our referral now easier. When we need the police to come in, they're not going to ask like, they need funds to come and help us support the survivor or just rescue the survivor. Because now they believe in the work that we do. They've come to know within the community the work that we do. So in now relying on the government stakeholders that are available, then we are able to cut in on certain aspects of like providing services that actually require funding. Okay. But we really depend on like the individual and donor funding, which is also shrinking.
Okay.
Yes.
Caroline, this is Maisha Girls Safe. This is like a, not quote unquote, for lack of a better word, a smaller sort of institution as a single entity. Let's move to SHOFCO. SHOFCO is a bigger entity, and the same financial crunch that they're getting from donors is also the same thing that you're looking at in terms of ensuring those coordinated efforts continue at least at the same level. What have you been able to sort of rework to see to it that the work still remains the same?
Okay, for us, we've been able to really work with the community. As Kennedy, our CEO, said yesterday, we are really grassroots. So what we've done, we've empowered communities to really like own the issues of GBV discussions in the community level. So we've really built a network of gender champions who are really on the ground level to really help us identify these cases. Thereafter, we build a system where the cases are referred directly to case workers and senior case workers and the structure of SHOFCO, where they're able to link with different government structures. Like, for example, in Nairobi, we've mapped the Nairobi sub-counties, the 17 sub-counties, where we have gender champions within there. We have case workers, program officer, and regional leads who work directly with gender focal persons, who are government officials. Like, we have the Kibera Langata focal person in charge of gender. So anything that we get, we also report to them, and any cases that we get, they're able to link us up to Tumaini clinics, the GVRC clinics, and also Coptic, to be able to manage a multi-sectorial and multidisciplinary way for the survivors. Because one thing about, as Maisha Safe House have said, working with survivors and also providing safe shelter is very expensive. That is basically response. So doing a lot of preventive work on the ground level and also linking it directly to response and integrating it with government facilities and other partners has really made SHOFCO to really expand our work in various counties. Currently we are in 15 counties, and what we've done as we started the work is to align ourselves with the national strategy of GBV and working directly with the gender focal persons within these counties to help us navigate through the system, navigate through the services that needs to be provided, like medical and also police. So we are working directly with police stations. We are funding police desks to improve their response on GBV, especially SGBV issues, and respond to survivors better, and also refer survivors to the relevant safe houses that they'll be able to be supported within 72 hours. So that's what SHOFCO has done.
Okay.
Yeah.
Well, just in the discussions, we were also privy to the information where we're given examples. Yesterday, we heard of a scenario where one of the survivors who was actually in one of the police stations was molested by a police officer. So that was another case that was there. And I just want to come back to you, Georgina. When you're looking at Kilifi County is a far-flung county. It's vast, and you're looking at its nature as a county. You find that these counties that are not primarily urban counties, a lot of things happen and they're slid under the rug. Looking at this new funding that you've received as a county in this financial year, what are those mechanisms you're putting in place to see to it that when these survivors get themselves to these police stations, we don't hear of such cases where police officers are actually, again, molesting survivors?
Of its own. Yeah. And as a county, we are going to advocate for information to reach to the grassroots, and through radio talk shows, through dialogues, through already existing community structures that go to the village level, so that the people are aware of their rights, they know where to report, they know the referral pathway, and we make sure that we also disseminate the calls where they're able to make, like 1195, like 116, that they are free of charge, and at least they are able to be assisted from wherever they are.
Okay.
Yeah.
All right. Well, we've had the experts speak their minds on the same. I want to open this opportunity to the plenary here. Anybody with a question towards the panel? I don't know if there's an extra mic somewhere. Is there? Yeah, let's see if this one is working so that Mesh will be assisting with passing the mic. So I'd request, when you specific person you'd like to answer that question, maybe just mention the name as well. Oh, okay. All right, where was the question?
Good morning, everyone. My name is Maureen Sharon from Neuro Kids Warriors. I have a question for Homa Bay, Kilifi, and Bungoma, because there we have so many challenges when it comes to rural areas, especially in Homa Bay. I'm sorry, but I'm from there. I know how things happen, because here is whereby there was a pastor. And I'm sorry if there's any pastor who is here. I'm not saying it's you, but I need to and I know people know, but some don't know. Men are being molested, and that is GBV. They're not talking about it. And I will urge more men who are here to advocate for other men who can't talk about themselves. And for Homa Bay and Bungoma, I would like to ask, you guys need, you say like you want funds, and yet you don't have policies. So how will you be helped? And in rural areas is where we have more challenges. How do you want people to help you if there's no enough policies? And if you, I heard the madam from Bungoma saying like they can't track people. If you can manage to track someone from Nairobi to Homa Bay, how comes you can't track someone from the other side to the other side? It's very irrelevant. And again, in terms of emergency, I heard you guys talking about accessibility and everything. In those your safe house, do you have sign language interpreters? Because most of the deaf people are being defiled, but no one is there to translate for them. Most of women with disability are being defiled. No one is there to talk to them, because we had last week at our breakout rooms when Brenda was saying, no one, unaenda unaulizwa, kwani hadi wewe. So it makes women with disability feel like, kwani hawa hawana feelings, you see? So I would really like to urge most of us who are advocating to advocate more, especially men, teach other men to talk on themselves. Thank you.
Is there any other question? I think, Henry, you'll take the deaf. Then I believe there was a question in terms of tracking for Bungoma and Kilifi, if I'm not wrong. Which other question? I hope you're just noting them down so that when, yes? I think we have about 3 minutes, so I'll take, please, just one more. Okay, those two more, please, one. Let's not take too much time. We're out of it.
Thank you very much, our speakers, and thank you, our moderator. My name is Joshua Adem from the Hope Hospice, Kenya, and I have 2 questions to our panel. The first question is, I would like just to know from those who are under the sheltering of the survivors. In Africa, you know, we always have our way of life. And when you bring the survivors, you find one is a younger, the other one is a grandmother, and the other one is a mother to the other younger one. So within your shelters, what is the criteria you take so that these people, when you keep them in these shelters, they can recover? Because I don't believe that if you bring all of them generally, the mother, the daughter, and the granddaughter, together under one roof, there will be a recovery and there will be a harmony. So can you tell us, how do you classify these people so that they recover quickly and they get integrated within the society? And then my second question goes to the same. In the same area, as you bring the survivors, how do you locate them? Because if somebody was victimized across the road here, then you cross over the road and the survival shelter is across the road the other side. I don't see them recovering quickly because this person will remain stigmatized. So do you have any mechanism within your counties to bring a swap to make these people to heal faster than bringing them to the same locality where they were victimized? Thank you very much.
Okay, thank you, Mesh. I think you bring the mic so that we answer this. Let's have them respond to this. We can pick the other ones after this is done. Maritim, it's working? Is it? All right, so we'll just kindly let's respond to them as quickly as possible. Let's not take a lot of time on this.
Okay, thank you. There was a question on disability. That is one he cited, for example, a deaf person, how we deal with them at the safe spaces or shelters. I will say that on sorry for that. On behalf of Homa Bay County Government, we are disability friendly and we are mainstreaming it. At the moment, I'll combine it with the first question on what the county government is doing. The county government of Homa Bay is at the draft stages of a bill that is already before the exact will be forwarded to the assembly so that it be an act of the county government that will help address on such issues. So when it comes to issues disability, the department has made it through the communication department that if at all there is a case, for example, that they've presented, we will liaise with the office and find us a communication person, a communication expert who will help us interpret and get to communicate with the survivor to get exactly what their concern, what their problem in terms of communication is at the safe space. Also to report, the facility that was constructed by the SHOFCO, it covered the disability aspect in that the structures we have are disability friendly. So if you find people maybe moving on wheelchairs, it was accommodated at the time of construction. And then there was also something on, if for example an incident has just happened across the road, and this is the facility. For a best practice, we will consider that because at that particular moment, that particular environment is not friendly for the healing process of the survivor. So we will liaise with other safe spaces, be it individually owned, but the government is aware of their operation so that we transfer them to such environment to help them in the healing process as they recover. And this one takes the consideration of how best do you approach this survivor for them to understand, is it fine for them to be here, and what are the implications of you referring them or transferring them to the next facility for their healing process.
Okay.
Yes.
Okay, on the next question, what criteria do we use? Most shelters have standard operating procedures. There's specific criteria we use when we are receiving survivors to be admitted into the shelter. That is one. So one thing we've done also, we've tried to improve the age-appropriate accommodations. If we receive a case of a child who has been defiled and our grandmother who has also been raped, what we do as SHOFCO, we have a standard operating procedures. We network with other partners, like other partners who are supposed to be online, like Kenya Wellness and other shelters, where we transfer clients from one shelter to the other with a clear case management model and individual plan. Then when it comes to integration, every survivor has a pathway of reintegration. We know integration is challenging, but depending on the pathway a survivor needs to be done in terms of individual plan, we are able to identify what pathway the integration should be. Then on the issue of removing a survivor from one location to the other, that is also well done and also within the standard operating procedures for all shelters that we've mapped, whereby if an incident has happened in somewhere in Bungoma and the client cannot be within that area, SHOFCO coordinates with other shelters to transfer the client to another shelter far from the location of abuse with a clear case management strategy that are done by the regional leads and the POs. Thank you.
Just to echo the words she's spoken, when it comes to now criteria, I think for us as a shelter at Maisha, we really reach out to children. For us specifically, our standard operating procedures are now we deal with basically children, and anytime we are getting a case of a survivor who's older or is not a child, we ensure that we also partner with other organizations like SHOFCO. They're able, like for them, they would reach a higher category, probably the older girls. So we also do referrals because partnership is important in the work that we do. And for us, when it comes to now reintegration, we are a shelter that provides now our services are integrated. So when a survivor is coming to us, we ensure that they are receiving all these other services, healthcare, legal, is it education, is it empowerment, then eventually reintegration. So for long-term recovery, we are looking at a survivor who has really received these integrated services. And now at a point of reintegration, they really are at a point where we are looking at now taking them to safer environments. Is it that they're transitioning into a life out of like now the environment which they were abused? Some would go away from those environments. Some probably would go into different environments. Is it their relatives there? So we have a whole plan when it comes to now ensuring that a survivor has long-term recovery. We have a whole case management to ensure that there's long-term recovery for a survivor, from criteria to now recovery. And for us, we have the exit goals at the entry of the survivor. So when the survivor is coming into our shelter, we are already looking at the exit goal for this survivor. What is the exit strategy? So we start from exit, then eventually now we do case management.
Okay. The first questions. There was an issue she raised about we don't have policies and then we're asking for funding. And I want to say that not every county doesn't have policy. It depends on the counties. There are some counties already have the gender policy and the GBV policy. But I've said specific for Bungoma, the policy has been drafted. And the work of the State Department for Gender is to provide technical advice during the drafting of the policy. But now how the mechanism of how the policy will be moved through until it is passed, it's the work of the county government. And at that point, our hands are tied. So when there is a delay in Bungoma, we can't really say the State Department has not done its part because the policy has been drafted. The other thing is she asked how the challenge of tracking. I said if you don't understand, if you need to understand the rural of the ruralness of some counties. If there is no network, literally there is no network, literally electricity phones have not been charged. People have to go very far to charge a phone. So for that time, within that time when the survivor has gone, somebody has been abused, getting even how to track them. And I've said when they cross over to the other side, it is definitely a challenge. You can't be able to, because they are being taken there to be hidden by their relatives. So they make sure they don't have any phones they have gone with. So you cannot be able to access them. That's a reality on the ground. And saying it is not there would be lying. But those are the challenges that you encounter. Two, one of the things that has helped us is the strength of the gender sector working group. And I really wish that we are working on that to ensure that the gender sector working group is cascaded in every sub-county, because that is the platform that has helped us to not only bring many people on board, because we have almost everybody represented, but also to help us capacity build the community with the minimal resources that we have. Thank you.
I'd like to respond on the issue of pastors and being drivers of GBV. And I think this, we've seen it even in TVs, in radios, and even the places that we are from. There are cases that have emerged from such setups. And I would say that what helps is bringing these religious leaders on board in such dialogues, specifically touching on GBV. And specifically in the Coast region, we've brought on board the Coast Council for Interfaith Clerics, because in it they have the Muslim, they have the Christian, they have the traditionalists also on board, so that we are able to educate them, we are able to give them the right information, we are able to sensitize them, and even amongst themselves, they are able to see and highlight and see if there is a potential risk in maybe one of their churches, in their mosque, or their areas of worship, where they could easily come in also and make sure that we prevent it from happening even before it happens. On the issue of shelters, for Kimbilio shelters, again, we work so closely with other stakeholders. In cases of children, we liaise closely with the children's department so that they are able to take them in, and they are able to allocate them in either the children's home or in a children rescue center. And for the adults, specifically women, we are able to work closely with Okwasasa so that they are able to assist in such. We have a challenge. We do not have a male-specific shelter, and I've not heard of one, so maybe that is a conversation that could start from here. How do we think about coming up with a male shelter, considering that now even men and boys are no longer safe in our community? So maybe that is a conversation that we need to pick up. For the recovery of survivors, I think training moral duty bearers will be a long step in terms of offering psychosocial assistance to survivors and victims of violence. So at least for Kilifi County, we have counselors, psychosocial counselors located at the ward level, and which the community are aware of. We've given the directories to the various offices so that the community can already support. And we also have now the community model safe spaces. We have CBOs that are offering spaces where and offer services such as group counseling, socioeconomical empowerment, giving skills, the beadwork, linking to bursaries, to higher education and such, to give to increase now the capacity of survivors to go back to their normal way of life.
Okay.
Yeah.
All right. Well, we've come to the end of this panel discussion, and I hope it was as insightful as it was for me. But of course, just in the interest of those who joined us virtually, before we take this tea break right now, we had other participants in the panel who had joined us via Zoom, and I believe they have a question.
So a question from online. Where do we draw the line between investigation and medical service for survivors of violence in the criminal justice system, as we address the elephant in the room of conflict of interest? From Mwangi Andrew. Then there is a question from Magdalene Keneni. This, I believe, will go to Miss Alberta. On Polycare, who are the healthcare providers providing services? Are they police officers, like medics, or seconded staff from the county government? Thank you. The third one from Zoom space was, what's an ideal gender desk in the police station? What's the ideal, like what's the expected?
I think Alberta can take the two, right? The last two, they're related to, close to probably what she talked about.
Yes. Miss Alberta? The last question was, what's an ideal gender desk in the police station? Then there was a question around the Polycare service. The staff, are they police officers who are experts, or is it persons from the county government?
So thank you. For Laikipia Polycare, the medical staff, so it's a doctor, when I was there, it was a doctor seconded from the county government. And the rest were the police officers. For the traffic one, the Polycare traffic police station, just here, the police doctors are seconded by government. So they're police. So within the police, they also have the different professions. An ideal gender desk, I would say, would uphold the principles of gender-based violence. Make sure that there's safety, make sure that it's safe for the survivor, make sure there's confidentiality, make sure there's dignity upheld, and making sure that then we are responding, that there's response for the same. So long as it's upholding the dignities, so it's okay. So for me, an ideal one, then coming from the same principles as a GBV protection center, is that it's not obvious. So it's not, and it's non-judgmental. So it's not obvious that you're walking in. I should be comfortable walking in as a survivor. That's what I can say. Not judge, getting the immediate response. So don't make me sit there to start writing a statement. Refer me or take me, and make sure I'm safe and getting the medical treatment, because it has to be within 72 hours and I have to be safe. I have to feel safe. Do not release me, for example, back to the perpetrator or an unsafe environment, and just making sure that I feel comfortable and the right referral mechanisms are there, tailor-made to the needs that I have. Thank you.
Thank you. I believe the concerns have been addressed from the online mesh. If there's anything you need to add before we take the break.
For inclusion purposes, online again, what messages will survivors want policymakers and communities to hear when they visit our different shelters? That is a question to the persons who are in shelters.
Give Carolyn this.
Sorry, I didn't get the question.
What message would survivors want policymakers and communities to hear when they visit our different shelters?
I think the messages that we want our survivors to hear when they visit the shelters is if the shelter is providing services with dignity, survivor-centered, and also looking at the integration and exit strategies that are clear and empowering them to be able to rebuild their lives and rebuild hope. Those are the messages we want the survivors to hear when they are leaving shelters. Okay. The other question will be answered by the Bungoma State Department.
They've been addressed, right? Yeah, I think that's all. I think they've all been addressed. So thank you to Georgina Dulu, Anne Baraza, Doris, Caroline Sakwa, and of course Henry for their representation on this panel. Also, big thank you to the guys who joined us virtually. At this point, maybe we take that break. I know we need to get something in our tummies. I believe it's ready, so we can just take a break of give or take, mashallah, about 20. Let's do 20 minutes break, then we get back and proceed with the other presentations. Thank you.
Thank you to our panelists and all of us for being very attentive through the morning session. And for the virtual community, we are break will be back by 11:15. On my right-hand side, same space we were yesterday. Kindly. Thank you.
Against women. This was ratified in Kenya on the 9th of March, 1984, and it obligates all states to take measures on eliminating discrimination and protection of women and girls from violence. It also mandates all states to take appropriate measures to ensure that there is women development and full enjoyment of human rights, and by this, it obligates us as a country to be able to make sure that we have policies and programs running to support women from all forms of GBV, like FGM and the rest of the various forms of GBV that our women and girls are going through in the country. There's also the elimination of harmful stereotypes and practices, FGM amongst them. And it also stipulates us to ensure that there's equal access to health care. Under health care, we have a lot of emerging issues on mental health, maybe especially for men. Let's ensure that we have some of those services, we have funding for services that are going to address issues of mental health in the country, and not just mental health, all other GBV-related issues that are faced in the country. And we need to ensure also that in our programming, let's set aside resources to support the psychosocial and other services that may be required on the various forms of GBV that both men and women are experiencing in the country. It also obligates us to ensure that there is equality before the law, that is the justice sector, to have enough budgets that will be able to address all gender-related barriers to justice. And it also ensures that there's protection from gender-based violence, which has given various recommendations as a country to ensure that we're able to fully have policies in place and programs that are going to address cases of gender-based violence. On the Beijing Platform for Action, which was ratified again in 1995, Kenya adopted this Beijing Platform in 1995, and this is a political commitment. And it identified 12 critical areas of main concern for us here is the violence against women. And in that aspect, we are all expected to ensure that at least we set aside funds to be able to support programs that protect women against violence. And we are also obligated to ensure that we cooperate a gender perspective and budgetary process, and also allocate resources for programs that address cases of gender equality. On the SDGs, which is the Kenya's Sustainable Development Goals, we have 17 SDGs, but we mainly focus on SDG 5, which focuses on gender equality and empowerment. And some of the 6 targets under the SDGs that we need to focus more on and ensure that there's funding to support is on elimination of discrimination. Let's also focus on elimination of violence and elimination of harmful practices. Another target is to recognize and value unpaid care and domestic work. Let's set aside resources to be able to make sure that this is being addressed, and support women in leadership and decision making. Specifically under SDG 5, there's A, B, and C. There's a focus on ensuring that we adopt and strengthen sound policies and enforceable legislation for the promotion of gender equality and the empowerment of all women and girls at all levels, which includes that coming up with the systems that will be able to track all the public allocations of gender equality. We need to come up with a system that enables us to track all the financing and budgetary process that are supporting various programs on gender equality. This other one is also on Africa Charter on Human and People's Rights, on the rights of women in Africa. This is a regional commitment that was ratified under the Maputo Protocol in 2010. This is specifically applies that all African countries must be are obligated to make sure that measures to protect women's and rights are implemented, and also measures to eliminate discrimination and address violence against women. Some of the other international legal frameworks that are not only addressing issues of gender equality are as listed, but at least they have a component that supports gender equality and empowerment, is the International Covenant on Economic and Social and Cultural Rights, the Universal Declaration of the Human Rights, there's the United Nations Convention on the Rights of the Child, United Nations Security Council Resolution of 1325 under the Women, Peace and Security. We also have the AU Agenda of the 2063, International Convention on Elimination of All Forms of Racial Discrimination, the International Covenant on Economic, Social and Cultural Rights. We also have the Intergovernmental Authority on Development, and the EAC, that is the East African Community. Just to wrap it up, I also want to share with you on some of the Commission on the Status of Women, which receives and agrees on conclusions that were done this year in March. And this CSW is something that happens every year, and the implementation, the reports of some of the programs we do as a country on gender equality and empowerment is also shared yearly. And as a country, let's just improve on how we'll be able to improve on our GBV financing so that we're able to implement all the programs that we are very good at planning, but let's now also improve on ensuring that we have resources to enable us implement some of those good programs that are on paper but not being actualized. Thank you.
Thank you for that presentation, Geraldine Omukaga from the department. Next, we'll have a presentation from a lady known as Judith Midamba. Judith Midamba serves as the Assistant Director for Partnerships and Resource Mobilization under the Women Enterprise Fund that basically focuses on creating another avenue. Women generally, both genders can have access to funding even as they wait for your typical day-to-day funding models. So Judith, karibu.
Good morning. I believe it's morning. Good morning. The energy levels are really down. Good morning. Thank you. My name is Judith Midamba, as you've heard, and I'm going to talk about a source of fund that the government has available, and it's open and it's available for women. And the beauty about this funding source is interest-free. So as discussions are being held on how to establish the GBV fund, there are still funding sources that the women can enjoy. Women Enterprise Fund, we are a saga We are known as a semi-autonomous government agency, and we are under the State Department of we were formed in 2007. I don't know how many of us have heard of Women Fund, but we have been around for many years. We have supported women across Kenya, women, funded and trained them in their businesses. What does Women Enterprise do? One, we provide capacity building. When we say capacity building, we have a robust curriculum where we teach the women how to come up with a business idea, how to invest, where to invest, and also how to manage your business. And it has so many things that support the women. And then we provide access. When we say access to credit, we give a subsidized loan. This loan, it is interest-free. It only has a WACC of 6%. We provide infrastructure support. This is through helping them get marks and also different facilities that benefit the women. And finally, market access. We help them enter into domestic markets, global markets. There's a way we do it. And the women who have suffered GBV, they may want to start from the beginning. If we're able to do them, we are equipping them, then we give them the money, and we support them to get the market. It's a whole can really stand and begin their life out. Because sometimes most of them have lost so much. So how do we do this? The group has to be registered. I know within the centers, we can organize the women to register, and they register with the Department of Social Services. They need to open a bank account, and then they'll get the training, and then is there interest? There's no interest to the loan. How they apply? We are present in the 290 constituencies in Kenya, able to access the women wherever they are. We come where they bring them to a specific place. We have a training certificate. They get the training, they fill the application loan, and within 14 days, the women have their loan, and they're able to whatever project they're starting and repay back the loan. So how is our loan structure? The groups begin with 100,000. Once they start, they move to 200,000. Once they pay that, 350, and they grow all the way up to 750,000. Of course, they may not be able to pay within those periods. So those are discussions we can have through our gender directorate on how to accommodate them, because they may need more time to be able to settle into their new businesses. So the group must pay the loan to get the next loan cycle, and it has to be paid within the period. Is the additional training needed? No, it's not needed, unless we see a gap and the women are not able to manage their business or anything, because our constituency officers visit them and see how they are developing. Interest, one-off admin fee, and they're able to continue the business. You have a training fee we have for the groups, and we give them a loan tracker booklet. This booklet, it enables them to track their loans, to know this is the date of paying, we have this balance remaining, and if they're told to pay when they think they're finished, a reconciliation is easily done, and the women are able to move to the next cycle. We have groups that began from, initially we used to start at 50,000, and they have really grown. I can give you a case in point of one group in Kilifi. When the women came together, they know how to handle their children, because they had children, not everyone could go out. So this group began a care center So one of them used to stay back, watch the children, while the others go out and do their different businesses. And we're happy to say that this small daycare that began with 10 women who just wanted one of them to watch their children began a daycare center, it grew to a school, and currently as we speak, they have students up to grade 6. The school is registered, they have now provided them. Small beginning. This small beginning can grow into a mountain. And with that, you can pick our contacts, you can like our page, go to our YouTube page and see some of our success stories. We're on Facebook, and we continue to encourage people who have heard of Women Fund. Women at the rural places, they may not have such information. We are doing a lot to do a lot of publicity and enable women to be empowered in Kenya. So what we say is when you empower a woman, you empower a family and a whole nation. Thank you.
Please let's appreciate her again. Thank you so much, Ms. Judy, for that powerful presentation in regards to financing. I know this is an area probably most persons, again, are not aware of, and we can start taking advantage of it. At this moment, we'll be transitioning to a discussion that is informed by the two presentations that have been done. Just to lay a foundation, the plenary will be able to discuss on co-financing models, GBV fund. And this session is going to be led by Alan, who will be able to call in front the panelists. And then it's also an open space for us to engage. I know a number of us had questions. We've been trying to cut them off, but for the next 45 minutes, we can take advantage of asking those questions in relation to financing. Karibu sana.
Thank you, Mesh. Maybe if we get some assistance to put this down. Okay, thank you for that. Well, it's time for us to get on with the next panel discussion, and of course it's going to touch on financing, just as you've heard from the Women Enterprise Fund there. I know naturally as Africans we are not accustomed to taking credit or getting loans, but trust me, from a personal perspective, you can't build anything substantial without accessing credit. Not unless you come from a rich background or an affluent background. As long as you have a plan on where that money is going to be channeled to, I'd advise you, take advantage of banks, SHOFCOs, Women Enterprise Fund, go get that money and start building something for yourself. With that said, let me welcome the panelists for this next discussion. I'll begin with Alberta. Alberta will be representing the civil societies. Next we have Angela Ngetich from Shuma, who's the Director for Gender and Youth from Kilifi County, as well as bringing back Judith Midamba, who's Assistant Director, Partnerships and Resource Mobilization. So just to clarify as to what Mesh talked about earlier on, we've been having these panel discussions, but we have very little time for the plenary, and I know there are a number of you who have questions to ask. So I'll minimize this conversation here in terms of the questions, probably give them 3 or so. Then after that, open up the space to the plenary to shoot their questions, so feel free. Okay, well, they're now seated. Of course, as mentioned earlier on, this panel is focusing on financing. And I want to begin with you, Alberta, now that you're seated immediately next to me right here. When you're talking about financing, people look at it from a general perspective, but we have different drivers. We have different aspects of different projects. What are those key cost drivers in the planning phase?
Okay, so cost drivers, yeah, planning phase. So good morning. So the key cost drivers, trust me, my head is just going to the cost of survivors because that's the heaviest. Exactly what needs to be addressed. Two, in whatever area, whether it's response, prevention, advocacy, is then to places you need to address the social norms. So as much as you're going to plan for the response, you need to plan for the prevention, the ecosystem around it. Yeah, there's also then the shelters itself, there's the shelter managers, but we realize then we also have to work, for example, with the GBVCs, with the referral network, with the legal, and specifically the judiciary, with the police. So that also has to come into play. Again, also the community, I'd say it's also a cost driver in terms of community and also, let's say, local leadership and government leadership, because they have to understand, and you also have to work around what at GVC call managerial stewardship. You need to have that buy-in at the first level to be able to make the whole intervention sustainable. Thank you.
Well, just before I move away from you, Alberta, we know very well as a country, for the first time, I mean, there have been talks, and for the first time we're seeing the government being very pragmatic about zero-based budgeting. This therefore means that we're not going to get things carried forward into a new financial year. Every time you present a proposal, it begins from a scratch basis. Now, looking at that and also looking from you articulating to push for this GBV fund, how do you think is going to affect operations in this space? Because when you're looking at zero budgeting, then that means every single financial year you have to prove that we are starting from scratch. And does it not affect other projects?
I look at it differently. I see that, so one, government has been supporting. So I'll give an example of where work. Government supports, still would need more, but government, for example, would support the post-exposure prophylaxis, for example, or in the GBVC centers, they would support in terms of human resources and so forth. Now, why I find this different is because following the recommendations of the technical working group on gender-based violence, on ending gender-based violence, including femicide, the one that was appointed by the president, in those recommendations, then we're talking about the GBV financing. So as much as it's zero budget, there is an let's say an implementation matrix or framework that they're developing. So for me, already, there is an understanding of what it takes. So even if it's zero budgeting, we're not coming from scratch. We have an understanding of what exactly is happening, what areas are we supposed to intervene within, and things like that. So for me, this is more of, and that's government financing. It gives better sustainability because then it's government funded and it's also more focused. So even if it's zero budgeting, the next financial year, we would be then influencing and addressing what exactly, what are the gaps, so to speak, or what are the emerging trends? Because also, again, gender-based violence is not static. And every time you make a difference, you won't be starting from scratch, for example, last year. So currently, for example, we are working towards electoral-related gender-based violence, so to speak, prevention of the same, response of the same, hoping that nothing happens. So the seasons and the dynamics keep changing. And before then, we anticipate El Nino, for example, in August was thereabout. So the point is, it's going to be current. I think that's what I mean. It's going to be current and it's going to be real time. And I hope then if it's, if it's consistent, then it's sustainable and there'll be no gaps and dependence just on private sector or donors, for example. Yeah.
Well, Angela, we spoke about it on the previous panel. We highlighted how different organizations, NGOs, basically getting this cash crunch. And I know it's something that you're dealing with on a day-to-day basis, because for a very long time, the focus has always been on short-term funding. This budget has been provided for 1 year. This is budget. So what are those recommendations or moves that have been put in place so that we scale from short-term to long-term funding?
Thank you, Alan. That has been a question that we have been battling for many, many, many years. Most NGOs are perceived to be project-based, financed. But when you think about it, it's because we are on a response mode. And we are trying to catalyze the system so that we can be able to address the immediate needs. So to address that issue, partnership is a must. Everybody is here to contribute something. So how I see it is that partners like us and many others out there need to begin if there's nothing. Maybe like establish what is not existing and hand over with a very clear transition plan. Let me give a case in point of the current conversations around safe houses or GBV protection centers. We are aware that there are so many out there that are dormant, and whatever is there is not spread out. So organizations like SHOFCO are coming in to establish, but with a very clear plan of transitioning the same to an existing system, in this case, the county governments. So as we are establishing, we're already having conversations about a transition plan that is clear, where we are handing over, whereby we're expecting and discussing with the county governments to ensure there is budget for that, there is staffing for that, there is preparations to paying for utilities for that, so that there is continuity. Because the only way we know for anything to be sustainable is to ensure that these are embedded within the government systems. We are all taxpayers. We are paying for services that are being run by government. The other issue is how do we ensure we have result-based financing so that we are contributing, but we're ensuring that whatever we are putting in is demonstrating results, so that we can also be able to justify that if you put in resources in this pot, this is the results that is coming out of it. And then for us to be able to know that this is actually working, the results are telling us. So you put in resources on what you know works. Don't put resources on what we say business as usual, and it becomes more or less like a bottomless pit. It's like repeating the same thing, the same thing, the same thing, and things are not moving. Okay. So we need to ensure there is that results-based financing that is clearly tracked, monitored, and identifying this is actually what is working, and we need to stop doing this, because if we continue doing this, it is not giving us the results that we need. Lastly, we have to embed evidence. Track very closely, embed evidence so that we can be able to adapt to what actually makes sense. Because we normally say there's a lot of theory when we are setting up proposals, when government is putting up their budgets. A lot of the times is, we've done needs gaps, or this is how we've been doing things, and we've been doing this for the last 30 years. But once you embed evidence generation in that, a clear monitoring tracking system that is analyzed very well, and we can be able to actually identify, if you put in here, you need to target this particular space so that it can be able to unlock this. That way, then we'll be doing more or less adaptive resourcing, but also evidence-informed resourcing that is making sense and bringing the desired change that we all deserve and want. Thank you.
All right. Well, let me just put it out there. My next sort of concern here is not to put the government on the spot. I'm not putting the government on the spot. I work a lot with the government, so please don't cut the contract short. So here, now the next one is on the duplication of roles. You see, naturally, even according to the standards, as the government, the wage bill shouldn't give or take go past that 35% mark. Kenya is hitting well in the tune of 47 to 48%. That means the wage bill is gobbling up resources that should be used in other issues. And this duplication could very well be an issue that is affecting even the State Department of Gender in terms of budgeting. So, Mwagome, what would you say are mechanisms in which responsibilities can be divided to see to it that we do not have duplication affecting the overall budget?
Thank you. I think I already alluded to that in my reactions to the discussions that went on yesterday. The mandate. Mandate is something that should be able to guide us on where resources should go. So first we must kind of delineate the mandate for county governments for the two levels, the national and the county. And I thank God because IGTRC has guided the process. What I'm not able to clearly speak about is the goodwill to go to the last mile of the recommendations of the IGTRC in terms of who does what. That is why we are struggling to know whether gender as a function is a national government function or a county government function. And I'm here with a colleague from the State Department of Gender, Director Georgina Dulu. And we are literally doing the same thing, the same programming. We are just representing two bosses, the national government and the county government separately. What for me is the elephant in the room is the coordination part between one of the structures which is handling matters county government, the COG, and the national government. I'm not sure the talking terms and to what depth they talk, because literally speaking, I think, like you rightly put it, there's so much duplication. What I do is exactly what Georgina does, except I'm doing it for this other boss, and my colleague is doing for this other boss. And the issue of financing is really something that is so fundamental, because everybody is doing some bit, and for them to do those bits, it is funding. Unfortunately, we cannot account who is doing what and who's putting what in where. And so much as everybody is throwing something into the basket, but there's so much inefficiency because we cannot account to the last penny of the public coffers as government. So for me, I think there's something that our parliamentarians should be able to sort out very fast in terms of what goes where, because up to now, we are not sure what government allocates to the county governments in terms of particularly the gender sector, much as we agree that this is a shared function. How much? Because the rule of thumb is functions, or rather funds follow the functions.
Yes.
Thank you.
Okay. Well, coming to you, I mean, Judith, you handle a fund, and this is sort of like an option for women when you're still just basically experiencing this bureaucracy that comes with these other lending institutions. Apart from the typical funding, government and donor funding models that we've had as a country for a long time, are there any innovative ways that you've talked about or the plans are in progress? Other innovative financing models that you have in play that moves away from the typical government and donor funding?
At Women Enterprise Fund, currently we are 100% government supported. But we have had so many discussions, and we have approached donors to continue supporting us to be able to reach the women, because we've had a lot of budget cuts that have really prevented us from reaching the numbers that we want to reach. There are discussions we've had at management and within the ministry on different ways that we can continue reaching the different needs that are within the country. The innovative ways that we have come up with are looking at how to support maybe women in the green sector. Innovations. The young women are really missing out in our funding. There are discussions on how to reach innovations and how to support them. And this, of course, will come through donors and grants. The other ways that we're looking at it is PPPs with a country like JICA, for example, a country like China. They are really developed. And if we're able to get some of the infrastructure or even technical expertise to be able to support us, of course, this will catapult us as a country and even as an institution that is supporting women. Thank you.
Okay, just before we open it up to the plenary, I know people have questions for this. Maybe just cut it back across to the three of you. I know every other day you're sitting and speaking to experts, financial experts, and you're thinking of these other innovative ways. That's from the Women Enterprise Fund perspective. Maybe from a county perspective, have you thought of other innovative ways away from this government sort of county level funding?
Thank you. I guess yes. Mm-hmm. So far we have partnered with a number of CSOs, with NGOs. Good friends are here, SHOFCO, yeah. GVRC, and many others. Crew is in the house, and they're doing quite amazing. Unfortunately for us, about this particular stream of funding is the continued shrinking of the source, so that today, much as we have always known that Crew is advancing the agenda on skilling and empowerment, but at some point they have to go slow because of, again, yeah, where the funds come from. Yeah. So the innovative ways should include now income generating activities for particular institutions. The very facilities that, for example, the GBV shelters that we are establishing, can we have some form of like workshopping so that as they stay there, there is a particular thing they're producing that can add to what is the needs of the people at the facility. For us in Kilifi now, we are in discussions with SHOFCO and Aga Khan Foundation to see whether we can even provide as basic as even boga for those survivors in the facility. We grow our own boga so that it caters for some of where these funds should be going to. But beside, I think we need to do so much skilling for those that are there, for themselves as well as for the institution, so that as they're there, they learn the skill, but we are producing for the market. So I think such would be likely to enhance the source of revenue for the facility.
Okay.
Thank you, Alan, for that question. Just to follow on, I think we are almost aligned in some of the thinking. We have seen a lot of crowding in funding happening, you know, in different countries, different organizations. NGOs are very good at that. And I would also link that with blended funding in terms of I contribute this, government contributes that. How do we, all of us, come together? The only biggest challenge is the accountability and governance side of it. So as we are thinking about these innovations, how do we also ensure accountability and governance side of it? I mean, we've been talking about having a GBV fund. How can all of us contribute into one kitty and ensuring that we can be able to track in? Director Mwangombe here is telling us that accounting public coffers funds is, you know, with the different levels is a problem. So just from hearing about that, and we want to talk about having a GBV fund that all of us are contributing into, accountability and governance of the same has to be strongly instituted. We've been talking around, I think SIF talked about a lot about catalytic funding, and I think different people have brought out that. How do others come in to establish or start something, and then there's that continuity? I'm just repeating what I'd said earlier, but that also has to come with a very clear transition and accountability framework, so that if we are catalyzing or donors are catalyzing, then who then is going to ensure that as we are catalyzing, who is continuing to ensure that whatever is being established is run for the long hold? I think he's talked about some income generating activities. I cannot belabor that, but I'm just asking myself, most of the things that we're discussing have been done and are being done. I've been asking myself, what is it that is making this not happen? And I think it also closely linked with the segregation of responsibilities, whose mandate is supposed to be what. If there can be very clear, if there can be a very clear aspect for the gender programs in this country, national government, county governments, and then how do partners come in? That would be a very interesting way of ensuring that as we are coming in with resources, as we are establishing a sustainable framework of funding in our context, then there's also clarity in who is doing what, so that there is no duplication and we are not wasting resources that should have been optimized into doing something else for the community. Thank you.
Alberta, do you have anything else to add?
Maybe just something small, but all of it is mentioned. Also in terms of designing the interventions, I would say merging sectors. So earlier when we were talking about, for example, the GBVRCs, we were talking about polycare, we were talking about GBVRCs. So I'm sitting here and I'm imagining if then there's a center, for example, in a county health facility. So one, use existing structures. We have, for example, the community health promoters, we have the PNUs, we have the clinicians already at the health facility. So just enhance their capacities, and let them do the service, as opposed to having many other institutions. Two, if you're having, for example, a center, a GBV center, it can be an SRHR center, sexual reproductive health and rights, and provide the GBV services and provide the HIV where it's workable, for example. So for me, even as we resource for different sectors like the National Police Service, the education, the judiciary, the health, for example, the gender, is there a way that, because I keep saying that the survivor is one person, or the person being served is the same person, so how can we merge all these resources? And I think they're enough. And just add on accountability, as Angela was talking about, and accountability, as Angela was mentioning that, and Wangombe, and just make sure then the services are provided.
All right, it's time to open it up for the plenary, but before we do so, I'm just being informed that we are joined by one of our panelists. She was supposed to join us, but she's joined us virtually. She's Miss Rachel Kiru from WeHub. And Miss Rachel, I'm not sure if you can get me. Can you get me? Can you get me? Can you hear me? All right, as they continue to walk on that. Okay. Yes, Miss Rachel, I can hear you. Let's continue as they continue to work on that. DJ, could you kindly just kill that connection because of the echo and the fallback? It's out? Yeah, perfect. So let's open it up to the plenary. I know we have a number of questions, Mesh. Let's use this. So she'll come with the mic again. if you could be specific to who you're addressing the question to, that would also assist us in managing time here. Yes, so just carry the ladies.
Thank you. My name is Njeri Mwangi.
Sorry, if you could just get on your feet so that they see you. Yeah.
Good afternoon. My name is Njeri Mwangi, and I'm happy to have heard what about each and every person on the panel said. But your last question, the innovative ways that can be able to be solutions, or maybe in the departments they worked on. A while back, the government had the Victim Protection Bill and the fund, something that is on the pipeline, and which I keep feeling it would be able to fast track issues that we're dealing today on matters of GBV protection. Why am I saying this? When a survivor goes through gender-based violence, that causes them to relocate in most of the times. So most of the time, they may not be able to be in a community, for example, where they are able to access, for example, the Women Enterprise Fund. That is why I'm thinking, maybe I'm convinced the Victim Protection Fund would have been an alternative bit of it to be able to solve this, because I'm assuming maybe with the recommendations that we gave to the Office of the Attorney General, and with the recommendations that would come through into the fund, this would allow individual access of funds for someone to, before a survivor, to be able to access fund and live an economically stable life. And so I believe that the Victim Protection Fund would be something ideal. I don't know whether maybe the State Department can be able to respond where that went into, or they know where that is standing as for now, whether it's in Parliament or at the Office of the Attorney General.
Okay.
But that is my comment for now. Thank you.
All right. That's a comment, so we can probably get somebody from the State Department who will chime in on that a bit. Next.
I'm tempted to give the person on the back, then I come front.
Good afternoon, everyone. Sorry, I'm unable to stand because I have a situation a bit. My name is Abbott Okello from Cerebral Palsy Society of Kenya. I'm a board member. So I would like to address three things very fast. First of all, the way forward for me, especially on funding, as it had been asked, is creating something akin to what has been created in the housing sector, where there is a rate. I don't know whether they call it rate or whatever, where you put in funds in one basket to assist in establishing GBV centers. That way, it will, help give infrastructure to the places that are more needy, because there are places that I believe the cases are rampant, so then they'll be given a priority. The second one is for the government to work with existing organizations. That way it's much, much easier. So that then we can create, those centers can be created through established organizations who will then be able to run them, on behalf, probably you would say, of the government, or on behalf of the GBV victims and all that. It's much easier because then they already have employees and they already have the required, infrastructure or system, if you will. And then the last one that I'd wanted to speak about is, sorry, let me just get it on my phone because I'd put it down. The last one that I wanted to speak about is a digital platform. It's important that we create a digital platform that can help us in tracking the GBV cases. Because as it is, today you'd find that there is no data that can be relied on. But if we have we got a digital platform where this can then be be entered, it will help in two things. One, it will help in tracking the cases, but also it will help in creating data for us to be able then to know how many cases, where they occur, and what interventions can be done. Thank you very much.
Okay, that's also another recommendation. We're yet to get to the question, but it's a good thing. That's the beauty about this meeting. It's a dialogue, so it doesn't have to specifically be a question per se. Yes, yes.
Thank you very much.
Thank you for the opportunity. My name is Pierina Guantai. I'm a founder of an unset organization by the name Women on Reasons to Heal Network. I'm also an associate of the National Shelters Network. I just wanted to start by correcting what was said in the morning. There are no men's shelters. From our records, the mapping we have done, we have 4 shelters that accommodate men. Secondly, I want to thank the team for this very interesting conversation on financing, and ask to be allowed to belabor that operations of the GBV protection centers really need support, financial support and goodwill of the government, not just the ones that are established by the state, but also the ones that are established by the state actors. And then when the financing comes, we would recommend that it comes through the national government. We have experienced shelters that are existing, which have faced challenges when they are run by the county government and the leadership changes hands. That's our experience on ground, and maybe when funds are being channeled, that can be considered. Thank you very much.
Right. Recommendations, thank you. To the gentleman there. Yes.
Yes, thank you very much. My name is Engineer Ibrahim Adan Ibrahim, the General Secretary of NCPCDK, Nexus of Caregivers and Parents of Children with Disability. This is an association that unites 47 counties. And my question is that since NCPCDK majority members are the women, the mothers who have the children with disability, and we appreciate what about this, the funding that we heard about it. Then what is specific, the program that the WAVE have, the mothers, for mothers and caregivers of children with disability, how many whom cannot engage in full-time employment because of the caregivers are full-time?
Okay. Sorry, come again?
There's a funding that about WEF, W-E-F-P. Yes, then more of the caregivers in numbers are the mothers. And what is specific we have for the mothers and caregivers of children with disability whom cannot engage in full-time employment because of caregiving is full-time responsibility.
Okay. I believe that has been captured. Okay. Any other question? So that we just pick this. There's a here. Okay. Kindly let's keep it moving a bit quick and
hi,
on the questions.
Everyone.
Yes.
For me, about accountability, because I've had like 2 speakers are talking about accountability. I feel like since we have more GBV groups, can we make it to be a one consortium in a way by we can also create one portal that we can know where the survivors are, just like the other HIV and AIDS have their one line, like someone can't go somewhere without being identified on the list. And again, about sustainability, as we check on our bill that the government have just passed, we have some raw materials that they were saying that they can be exported. And yet we have them here in Kenya. Why can't we identify some of the organizations under GBV centers that are working on that, so that they may bring the projects into the GBV centers, so that they may help the GBV centers on sustainability part of it? And again, my question now is about, we are talking about the victims. As we talk about the victims, do we check on the health of the first responders when they are going to rescue the victims? We need to check on their health, because these are the people who are here in the ground and they feel the heaviness of everything that is happening. So if we ignore like they're okay, it's like we're ignoring their capability in terms of they go through a lot, especially when it comes to saving in slums areas and also in other areas. So I feel like we need to allocate some funds for them, or check on their health and their mental health, because it's not easy outside here.
Okay, thank you. That's it? All right, the gentleman there, yeah.
Thank you very much, Mr. Moderator. Thank you, our speakers. My names are Joshua Adem. I come from Hope Hospice, Kenya. And I have only one question, and it is a concern. And this goes to the shelter managers. As you are preparing to get your funding, you know, in our country, we have a problem with managing our finances. Most of the times we receive the funds, you are told the funds are on the way, but there's a diversion before they reach their destination. So my concern and my question to the shelter managers, how prepared are you with the funds which you are going to receive? How prepared are you? Is there a way whereby there is a way you are going to ring fence these funds, that when they reach their destination, they will do the specific and exact what they are meant for without being diverted? Thank you very much.
All right. So just as we get this, maybe mesh Pasaris, there was a question. There are two key concerns that have come across that are relatively fresh for this discussion. I'd just love you to give the mic back to her, because we have a representative from the State Department. There was a concern she'd raised about certain things that got lost in the wind here.
Thank you for the opportunity. My name is Njeri Mwangi, and I'm here to ask a question on the Victim Protection Fund and bill that went through public participation last year. The bill was supposed to create an agency that would be able to handle victims of survivors of gender-based violence, and the fund is a pool of resources where the survivors would be able to access funds from and get financially fit and get to be financially fit so that they can live dignified lives. And so we were wondering, because it was quite a good model where we would be able to host the data, would be able to host a portal that has all this information, that would be able to host the data of the survivors in dignity and in accordance to the Data Protection Act, that would be able to inform policy, because all the survivors, that is their one-stop place for them to register, to be able to be known that they exist, and also that is going now, the fund again, according to how the bill read, was going to be the oversight body over the agency that was to be created. So at this particular point, it is 1 year down the line. I'm wondering, where is it? On the same case, I'm looking at it politically, somehow, just a minute, that we have 2 billion that was put in this year's budget, into the upcoming year budget, and it's supposed to cover the reparations of the victims of protests. Having the process began, the Victim Protection Fund process began earlier than this other process, we can be able to see that clearly political goodwill has taken shape. Again, as leadership, is there a political goodwill to have the fund get into actualization. Asante.
Okay. So I don't know if Josephine and Mwesh can take that before we get it back to the panel for the state and yeah.
Possibly before we respond to that, Hesh wants to just speak on something. She's supposed to be part of the panel on GAF, just briefly. Yeah.
I like the way I was supposed to be part of the panel. Okay, so the National Government Affirmative Action Fund is a fund that was given to women reps as patrons. So it has different votes, and one of the votes is under county-wide, and that's where you can do projects. Now, we're trying to change the regulations. You have to understand that GAF is governed by regulations rather than legislation. It's not anchored, and you've seen NGCDF has also got its own problems. But one of the areas that we focus on in marginalized communities, we focus on PWDs, we focus on women issues, we also focus on youth, and we also focus on sexual gender-based violence. So that's why you find, like for me, under GAF Nairobi, we saw that sexual gender-based violence was the big issue. We decided to try and do a project starting from the police stations with GBV units, Polycare, to support a few. We've done 8. We've not launched them because the police stations have been asking, when you launch this, who's going to provide the food for the people that we're going to house, whether the children or the women or the men in those units. So it's a discussion we have to have. So and GAF does not have a vote for recurring expenditure. That means I can put up a safe house. The land has to be provided by the county government, and it took me 4 years to be able to get land from Nairobi County. In fact, when I found the land, right, in Westlands, that land had already been subdivided. It was public land. It was already subdivided, and half of it was going. So when I went and I said, this is public land, can it be re-amalgamated so that I can get this land? I made enemies with the county government. Eventually, Nkananu came in as governor. And when Nkananu came in as governor, I grasped that opportunity. I went quickly. I said, there's a piece of land I've identified. I want us to have an MOU. I want to put a safe space for women of GBV. And quickly signed it. And we ended up with the land. Very valuable land, and we've put up 150 million shillings worth of a safe space. But now, the county government, in partnership with us, was supposed to also provide certain things. They were supposed to do the parking, which they've done halfway. There's a perimeter wall, the sewer system, because not one to blame the other, or but these are real challenges. But the safe house is up and standing, and now what we need is to operationalize it. We don't have recurring expenditure, so what do we need is the county government to create a budget, and they're supposed to furnish it. We're giving them a full structure. The thing is, they've not put the money to furnish it, and that's why I've been engaging the president and saying, can you visit this place, since you're passionate about addressing issues of femicide and GBV, so that we can find the money, furnish it, operationalize it. And that journey keeps continuing. I mean, I've been taking people after people after people. And I believe that within this year, if we can operationalize it, then we figure out how we're going to fund it, right? So for me, I came up with an idea. There's a lot of land in that area. And I said, what if we put a workshop, a furniture making workshop, and we train all our GBV survivors on furniture making, all right? And then what we do is we get contracted by the state of housing so that we can be making the furniture for affordable housing as one of the contractors. So that way, we're having sustainability, all right? So sustainability and funding of the safe house cannot depend on donor funding. State can give us money, yes. I believe that we need to have the funding to be able to compensate, because you see now the thing is, I'm looking at the state. Kenya is limited in terms of resources, all right? And I'm sitting here and I'm thinking, right now we've put 2 billion shillings and it's been a journey towards compensating post-election violence victims, demonstration victims, etc. All right? And I think it's right because they died because of politics. They also died because of police brutality or violence or excessive use. All right? But, you know, everything is relative. Okay? So for me, I feel that if a man wakes up today and kills his wife, right? Are you then saying that the state should compensate the wife? I mean, the family of the wife. You see, then tomorrow we'll come up and say, anybody dying on our roads also should be compensated by the state. I think there is a limit, you know, to how much we can get the state to do. But I believe that the journey that we should start on, women who deserve to be compensated are those who have been raped during political violence. And there are many who have also had children. Grace Agenda and I walked this journey for a long, long time. Those ones, yes. In that respect, they are also on the list with the 2 billion. And I believe it's a journey that we're making. And post-election violence, 1, doesn't end, and 2, women are affected, right? Back up to the everyday that Kenya has 1 policeman to 600 people. 1 policeman. Can't there are many more. What we need is also the government. I am sad. I'm sad because I'm thinking, I called my PA and I said, can you pick up something for me from Mission House? And she tells me, Mom, I didn't come to town. I'm at home. You know, I saw more than saying tomorrow is a normal working day. I hoped that we would have peaceful demonstrations and at the same time, you know, we would be able to continue with our work. Do you know the cost of today when businesses don't work? We're saying we want more jobs, and at the same time, we're part of the people who are destroying the jobs that are already existing. Because some of the companies are going to shut down. Investors are not going to come Kenyans the way we're behaving. They're going to say, let them finish the next election. We need to change our ways. The government is trying to provide what it can, but it will take time. So for me, right now, I'm more concerned about compensating everybody that was caught in post-election violence, with rape, with maiming, with castration, all of them, because that we as government should take responsibility. But then society also has to take responsibility, and I think we need marriage counseling. We need to provide affordable. We need you having conversations. Somebody once said to me, why do we think America is great? Why do we think America gets it right? I know that America has children sleeping on the streets. America has children hungry. America has huge unemployment. The thing that makes America great is that we are able to talk about it, and the middle class is growing, and the middle class is responsive. So all of us here can come together to do something. I was driving off here, somebody sends me a picture of his wife who's got lupus. He's not all his insurance cover, private. Child is already exhausted. He needs money. How do we help a person? State has done its part. What are we as society able to do? Right? So I think it's the time to really reflect as citizens. Right? Do we want to destroy what has been built up to now? Or do we want to continuously dialogue and work hard and avoid the blame and do what we can? I talked to Mercy Wanjao yesterday, me how somebody engaged her yesterday and really was saying, oh, why is this meeting happening? You people are wasting money. That money should have gone But the fact is, if we don't sit and dialogue and understand this money that we're spending here today, right, and yesterday, is what is going to inform how we're going to move forward. Things starts with discussion and dialogue. So I want us always to be objective, not subjective. So has issues in terms of expenditure. Others have to step up and give the money. The executive will put some money through Parliament so that we can do our part. But at the end of the day, all of us here have a role to play. So I really, really want, let's say if consume we are going to go even back than where we are today. So I'm telling, we need to really reflect the alternative and listen. I don't know why. Maybe social media, before hivyo, mimi ni Esther. Come if we don't have a government and if we don't have any.
I believe that has been fully answered, right? It's been answered from here to there. So I think on the Josephine had not touched something. Sure.
To include the returnees for
Yes, so that we speak on that.
Please don't be harsh on time. We came to dialogue, and I really appreciate the dialogue that is going on. Allow me to react. The Chief Officer, representing His Excellency the Governor, Dr. Sheila Yako. But I want to appreciate this because a lot of issues that we also discussed in the groups yesterday. To me, I think this is the best forum where we can discuss issues that are related to GBV. Somebody can say that we are waiting for the things that in psychologists, we have different specialists. That we do that affect our young ones, the generations that are coming up without interventions, where we have reached out talking of shelters. Who knew that Kenya would talk of such things? I am things that we're not able to talk about, we are talking about here. So appreciate the organizers of this meeting. We are some default funding. I think we discussed that. Activity going on within to the communities, and that is where culture is engraved. Without that funding coming, only a mad person can think that GBV is not a solution or is not a priority here in Kenya. I want to say that the issue of power imbalance is something that we will really have to create. And for those who are gender experts, as we look at the curriculum, Dr. Bonya, I want you to hear this because this is very important. I know we did the curriculum for gender, right from certificate to diploma to degree, masters and PhD. But there is a gender gap, and that is why the issues of GBV and SGBV will still continue. We allowed our society to bring up women who are highly empowered, but we did not allow our men to know how to live with these empowered women. So there is a very big gap in the curriculum where the man who is empowered and the woman who is empowered do not know how to relate. And this has a lot to do with our cultures. So we are not going to discuss issues of GBV outside our cultures. And that's why I'm insisting what SHOFCO is doing is good, because we will get homegrown solutions to the issues that are there. Because up to now, we have even women professors who are being abused. Why? Because
That does not remove them from the environment that men are the only ones who are supposed to speak. I want to say that let's move on with this dialogue, even up to the counties, so that we are able to get the right solution. Last but not least, the issue of the caregivers and the issue of safeguards that we need to be able to help us move on with our safe houses. I think this is something that has not been devolved at all. Remember, I talked and said that we are coming up with our GBV policy, but is it going to be anchored on the national one? So as we think about these things, let us move together and not pull each other, thinking that what the other arm is doing is not as important as the other. And we all need each other. Thank you, the men who are in this room, because I know you are the ones who are going to take this conversation to the grassroots. I like his questions. I don't know your name. I like your questions, but I would also want us to have a dialogue on how to convert that so that you become a real gender champion on GBV, so that we are not confrontational, but we are supportive as we move on with this dialogue. Sorry I've taken long, but I'm just excited. I wish the day was longer so that we discuss to the end. Thank you very much.
All right, let's give her a clap for her sentiments. Of course, now we get back to a panel. Just give the mic to Alberta here so that we go through it. It could begin on the other end either way as it comes back. We all had the comments and from the plenary, so we'll take 2 minutes each very quickly as we wrap down. But also as you're doing that, I think there was another big concern as you're answering on the lady who asked about these people who were sent out to go and respond. Is there anything to look into it? Because some of them are probably usually sick or could then again affect those survivors. Yes.
Thank you very much. And I think the discussions are really moving us forward to understanding and also to have a way forward. I'm going to talk about the unpaid work for caregivers. There's a national care policy that was discussed, and I think this was the venue where stakeholder engagement was held. And it's a discussion that is with the State Department, and I know it's going to be escalated to be passed, to be implemented as a country. We understand as an institution that unpaid care work is very high, especially for the parents who have children with disabilities, as well as women who are just taking care of their homes, even the house helps. If anyone is to quantify how much a woman does to be able to support her family, especially when she has a child with disability, she needs to be compensated. And I'm sure that with the support of the different bilateral and multilateral donors, and of course with the goodwill of the government, there is going to be compensation to be able to support caregivers. There are different groups that such caregivers could have to be able to get support psychologically, mentally, and also to know how to move forward, especially that unpaid work. I see the gentleman who asked the question is not there. Maybe we will dialogue with him later. Just to close, as an institution, Women Enterprise Fund, we do a lot of capacity building. And ways we can support also that maybe it's a discussion we can have with the people running the safe houses, is that these survivors, they can be equipped with different skills, like value addition of maybe making yogurt. When you leave that place, you can start something really small with different farming knowledge, with different ways to handle yourself as you go out there. As much as they are done for the counseling, they also need a skill to leave the center with. So maybe it's a discussion that we can have to be able to escalate that. Thank you.
Thank you. For me, I think I still insist, let us delineate mandate clearly. Let us know who is supposed to do what, so that we avoid wastage and duplication. And
I am following cue from the Department of Education in terms of bursary. There is a fund for bursary at ward level, at constituent level, at governor's level. Everywhere there is a bursary. If we were able to consolidate these funds, just like the way we are doing GBV, can we have a GBV fund consolidated and to exactly know who is in charge of what? Can the county do the structures, or can the national government do the structures? Then they leave the running of those structures to the county government, so that everybody does something, but very specifically, so that somebody else does not do the same. For me, I think we need to mobilize all those funds into a common pool. Then we see who will be overseeing the operation of those funds. Thank you.
Thank you.
Thank you. Without repeating, I think one of the questions came around accountability and potentially putting partners into consortiums. I think this would be a challenge to State Department, our strong partners, about how best can we be able to enhance and strengthen coordination. Because it felt that some of us are feeling like partners are scattered, and there is need for strengthening that part. On the issue of first responders, this is a very critical issue, and I would tag this by saying you cannot pour from an empty cup. I was listening to the speaker, and I can just share the SHOFCO model. All our first responders, the caseworkers, program officers, the teams that are actually first responders on the ground have to go through mandatory mental support. It is mandatory, because sometimes when you see the team moving and responding, and it's actually a lot of work, when you get used to something, you become hardened and you think you're okay until something hits you at some point. So for us, and for all the organizations that are actually having first responders, and especially also the counties, as we are getting into detailing of how we can be able to work with survivors, with the ones that are getting into operationalization of the safe houses, budget allocation, resources in every sense has to be allocated for the first responders, because they crack. And when they crack, then the survivors do not get the best support that is needed. So we do that by, ensuring there's that specific support for the first responders, but for those ones that have insurance covers, I think SHA, for the government side, to really consider a good allocation for mental wellness, so that we can get all the necessary first responders given that mental wellness support, and also introducing activities within your institutions to ensure that there is a way the first responders have spaces for de-escalating, just releasing. Sometimes it could be simple things like I'm saying I'm not okay. Today I'm not just coming to work. And there's a whole support system to ensure that there is space for them to actually rest, or just back off from day-to-day activities, so that they can be able just to cool down from the work that they do. I think I will not belabor the fact that clearly there is need to really have a fund in whatever shape and size, whether it is a consolidated fund or integrated funding, so that at every level we know that there is clearly resources ring-fenced for that. But I don't know if the GBV policy can actually be actualized, because I know government works in a manner that when there is the policies available, the reviews that actually happen, we need to know it has to be completed by the end of this year, so that then we know that money is following where the policies have been done. So my ask is really ensure the policy has been reviewed and finalized, so that then there's budget allocation for what has been there. And my final ask to that is, I don't know if there is a way that if that review happens, there's a clear clause or something, guidance, that if there's money ring-fenced for GBV, it should not be touched or taken through to do something else, because once the money then takes a different alternative path, then that means the work that everything that we are discussing here is going to go into vain. So as the reviews are happening, let us put something that says it is ring-fenced, indeed ring-fenced, and should not be directed for something else. But the implementers and the accountability teams that are actually ensuring that the resources actually are used for the purpose that it has been put for purposes of the GBV work that we are doing. Thank you.
Okay. Thank you, Angela. Finally, Alberta.
Yes, so I'll speak to one, the care for caregivers, the first responders, and what needs to be done. So I'll give practical examples based on where I work at GVRC. So one is having awareness, sensitization, so that then people can understand what is exactly secondary trauma, what's transference, what's all this, and how can it manifest to you even from psychosomatic diseases and so forth. So after that awareness, what we also do is going for personal therapy. That's also very important because, as you mentioned, you can't pour from an empty cup. You need to address whatever issues that are there, within yourself. Otherwise, you'd go meet a survivor and go like, wait till I tell you what has happened to me and so forth. The second part is supervision. So we have, for example, monthly supervision for case managers, social workers, psychologists. So monthly supervisions with shared confidentiality, so that then you're able to address what are these technical issues or what's coming forth on what's new that needs to be addressed. And then again, also debriefing sessions, not just for the first responders, but it affects everyone else. You can imagine once, so you can imagine even where I sit, and then you're reading reports and you're seeing all these photos and you have to make these decisions about who's going for, are we paying for this surgery and all that. So it affects everyone, even the accountants. Just looking at the 500 cases that GVRC in 1 month, the new cases and follow up, and you're imagining each of this is a survivor. You have your ages, so there's a lot of that. Then again, what also helps is changing of roles. You can't be a first responder every day. That can also crash you. Part of the reason, so I'm happy to be here today, not at the office. Thank you.
All right. Very well said. Of course, a big thank you to the panelists. Just as we wind down, it's time for us to now take that lunch break. All I want to tell Mwagome is good luck. He's mentioned collapsing all these bursaries and finding it into a single consolidated kitty. That's not happening in Kenya anytime soon. So I can tell you that for free. So thank you for participating in this and also having an engaging plenary. At this point, I'll just hand it over to Mesh so she can guide us on the next bit of this.
Thank you so much, the panelists, for that amazing interactive session. And I believe we've picked something from the aspect around the co-financing model. At this moment, we'll be breaking for lunch. It's exactly 1:09, if I'm not wrong. We will give you a lunch break for 1 hour. Please be back by 10 minutes to 2. Our lunch will be taken from the second floor. If you do not have a coupon, it clearly will tell you you did not register. So please register so that you can get a coupon for lunch. Asanteni sana. Oh, tunafaa kuomba. Nimeona somebody's mouth saying that. Let's pray. Let's stand and pray. We are praying for the meal. We thank you for the meal that has been presented before us. As we're breaking to consume it, may it be well with our bodies. And for the ones who prepared it, may you bless them. In God's name we do pray, trusting and believing. To our virtual participants, we'll be back at exactly 2:05. 2:05 virtual. For the physical ones, please be here 10 minutes to 10 minutes to 2. 10 minutes to 2. DJ, we can get.
Yeah.